I'm a Narungagana woman. I'm actually a mum of 5 children, which is, they're all in the health profession. So I'm very, very proud of that. And I'm currently the CEO of the Loitcha Institute.
Deadly. You have had some pretty big titles throughout your career. Can you tell us where you started out in the health sector and where you ended up?
Sure. So where I started was actually doing, job experience when I was in high school, and I tried out being a physio. And then the local hospital actually gave me an opportunity to try out what it meant to be a nurse. And I quickly found out what it meant to be an Aboriginal nurse, and I loved it. But the thing was that I actually thought that I was going to train locally in the local hospital, and that wasn't too big a leap in my thinking. But of course, then the whole profession changed, and I actually then thought about doing Aboriginal health work, and that's where I started studying Aboriginal health work. From then, I actually went into university and studied nursing at the University of South Australia. So that was my toe in the water, really, on the wards being an RN.
So during your career, what has been one of the highlights for you?
I think highlights come along in opportunities to learn, and some of those are quite difficult times. So I've often drawn on a moment where I was in my nursing studies, and one of the lecturers actually put up, and he was trying his hardest, to teach people about Aboriginal Torres Strait Islander health, and he put up, what does it mean to be Aboriginal Torres Strait Islander peoples? What do you know? And the rubbish that came out of my fellow students' mouths, people that were my friends, saying all these things about all the free stuff we get. I'm sure many of the Aboriginal and Torres Strait Islander peoples watching will relate to the fact that we're all still waiting for the free car. And, lots of people get a free education in Australia through the education system that we currently have, the public one. So, that was a defining moment where where I actually had the opportunity to step into this space and be brave and actually speak out. But the weight on my shoulders to say the right things, to change minds, was, very memorable, and not for all the good reasons. And then I think another highlight during, a couple of years down the track was learning about cultural safety. And that's really been a journey for me, becoming enlightened about the social soup we swim in and why people think the way that they do and how to unpack that with them.
I want to talk about something you mentioned in your highlights, about having to educate your classmates back when you started out. Do you feel like there's this burden, this unfair burden that falls on First Nations health workers, especially in mainstream services?
In my experience, it certainly has been, and it's an unfair burden because we're 3% of the population. The other 97% have most of the power and the resources to make that change. And I think it's unfair to remain uneducated. That's not taking your load on as non-Indigenous Australians. And so I think it's more about, and it's more fulfilling to do this journey together, than it is for one person to be dragging everyone along to the NAIDOC event or, the reconciliation event. And yeah, so that has been my experience. And I think Aboriginal and Torres Strait Islander peoples, we're very kind in the amount of times we are called upon to educate non-Indigenous Australians. And in that education, we're often retelling stories, that are trauma and compounding trauma every time we retell those stories. So I don't want that to be something that's dismissed. And what I'm saying to you, Rachel, is that not only are we educating and doing this work, but we're actually, reliving some really hard narratives, in our lives.
So considering, the weight that our health workers and practitioners have to carry in the work that they do, as well as just the overall importance of it, what does a National Day of recognition of these workers mean to you?
I think it's historical truth telling. I think it's an opportunity to celebrate, this unique and and much needed workforce that have done amazing things in our communities. They are trailblazers, you know, and so I think that National Day really is something that pays recognition and is an opportunity to celebrate. So I think another major highlight of my career, and it's very topical to what we're speaking about today. I was there the day in Parliament that Kevin Rudd actually announced as part of the Closing the Gap scheme that a National Aboriginal Torres Strait Islander Health Worker Association would finally be realised. And, you know, a day of recognition is, you know, harking back to not only that day, but the many years before that of Aboriginal health workers, you know, taking care of our communities.
We talk a lot about the cultural determinants of health, but how they actually, you know, manifest in work is kind of hard to pinpoint sometimes. So how do you see our First Nations health workforce embedding those cultural determinants in everyday interactions with clients, with our community, with our mob?
In a lot of ways, I think that the Aboriginal health worker and Aboriginal health work practitioner workforce, they are the implementers really, and seamlessly, you know, embedding the cultural determinants into our healthcare. I think it's about the system catching up. And if I can give you an example, that would be Birthing on Country. You know, in South Australia, I was a part of the AMIC program, which is child and maternal health. And Aboriginal health workers work in those roles. But of course, we don't have Birthing on Country as a policy and as programs nationally established. So I think our Aboriginal Torres Strait Islander health workforce, particularly our health workers and practitioners, certainly know their communities, what the cultural determinants of those communities and the priorities of those are. It's just actually about a cultural investment into the programs in those areas. So I think there are things that are nationally applicable, but absolutely things that are place-based, and our Aboriginal health workforce are the peoples that know their communities the best.
Absolutely. And just to wrap up, Janine, what is it about our First Nations health workers and practitioners that is so unique to other workforces in the world?
Well, I think, you know, Rachel, you said it, it's about the cultural determinants and that they bring that. It's about our ways of knowing, being and doing, you know, in that workforce. It's about their relentless love for their community. And that means, you know, that they don't start at 9 and finish at 5. That they continue to do these jobs in the face of being underpaid. But that shouldn't be taken for granted. That should be recognised. So I think, you know, the way that they've fought for, you know, their profession to be profiled and to be seen, and to also not be swooped up into thinking, you know, that the other health workforces like nursing, and they are, you know, absolutely, if you want to go into those, you can make pathways into those other careers. But there's many who just love their role and this is what they want to be. And you know, and that really is staying and serving in the communities that they love, and you know, going on to do work on behalf of their communities, and particularly in some locations doing the work that no one else wants to do. So I think that's the beauty of, and of course it's only Aboriginal Torres Strait Islander peoples. I think that's, you know, a pride that I particularly bask in.